And it's always great to see a smiling face here from Medicap Pharmacy who gives us some great advice. And that's what we are going to get today.
Hopefully. That's the plan.
So what are we talking about here this morning?
You know, I thought today what we would talk about, it is open enrollment period for both Medicare Part D plans, so the Medicare drug plans, and also the health insurance exchange. And I think it's a very confusing thing.
I think you hit the nail on the head. What does it all mean exactly?
So what the open enrollment means is that's a time where you can switch your drug plan. So only during that time period can you switch to a drug plan, and then you have that drug plan until the next year, until the next open enrollment period comes. So I think for a lot of people, you spend a lot of time trying to pick the right plan that covers your formulary medications, cost, premiums, deductibles, all of that comes into play. So.
What are some of the major differences? Why would you want to switch plans if you have one that's working now?
So some of the major differences is cost, obviously. So, and I think
that'd be really easy. You find the one that costs the least, and it's like not out of my pocket. Is that what some people do?
It is, but that doesn't always mean that you get what you get what you pay for in some cases. So cost, but what is it covering? So if we look about here, these are some of the things to think about. So does it have a monthly premium and how much that is, which most of them do, and that can vary quite a bit. And sometimes the reason it varies is based on the deductible. So what a deductible is that's the amount of money that you have to spend before the insurance company starts paying. Although sometimes they'll waive generic drugs and they'll say there's no deductible applying to generic drugs. So if you're on a very tight fixed income, you might not want that deductible because that means you're going to pay more at the beginning of the year rather than having it be equal amounts throughout the year.
Okay.
Co-payment, co-insurance, that's basically what we call your copay. So when you come into the pharmacy, how much you're going to pay versus how much the insurance company paid. So for a generic, it might be $0 or it might be $4 or $5. For a brand name, it could be 10, 25, or even a percentage. So that's something that you want to look at. Coverage gap, with that comes into play with Medicare Part D. So that's where you're still paying to have insurance, but you're in what we call the gap or the donut hole, where the insurance company is no longer paying for your medication. So you've been going along, you've been paying your premiums, you've been paying your deductibles, you've been paying your copay, and then you hit this magic number, and the insurance company stops paying until you get through that donut hole or that gap to the other side, which is what we call the catastrophic coverage. So if you take lots of things that are very expensive, you'll probably get into that donut hole. Okay. So it's confusing, right?
It is.
Now, is it just for the Medicare Part D, or is it for all insurance plans? Which plans are these for?
That we were just talking about is mostly for Medicare Part D, but it also would apply to the health insurance exchange. So, you know, the Obamacare basically plans as we talk about. So when you're evaluating those as well, those are all things that you want to look at. And then the other thing that I tell people is look at your providers. So, I mean, does it cover the provider that you want to go to? So do you have a the formulary, which you can spend a lot of times talking about the formulary. The one thing I will caution you about is that drugs can change on the formulary, so it can change both what is covered, and also your drugs can change. Maybe your doctor will change your medication. So I tell people not to put a whole lot of weight, and I mean, you want to make sure that things are covered, but really what you want to look at is, are generics covered and how much are brands covered? Because your formulary insurance companies, if they give you a 90-day notice, they can change their formulary. So you may spend a lot of time picking a plan that covers your really expensive drug, and then after the plan year starts, partway through the year, they'll give you a letter and say, hey, Lou, we're not going to cover this really expensive drug anymore. You have 90 days to find something different.
Right. Nice.
So it can happen. So, and you are with that plan now until next year.
Next year, so you can't do anything about it.
You can't do anything about that. But what you can do is come see your Medicap pharmacist.
I was going to say, where's the best place to go? If you have questions, obviously you guys are a little more up to date and up to speed on exactly what's happening with all of this. Can you go up to your pharmacist and say, okay, you know what I'm taking here, which plan should I go towards, or what questions should they be asking their pharmacist?
We can help you. We can't tell you which plan to pick,
okay.
But we can certainly give you a list and say, here are, we have some computer programs. So there's the Medicare.gov website, which anybody can get online and use. I would just caution you, we have noticed, we found errors in that both this year and in years previously. Usually involves, you know, pricing or it might say that we're not covered, that you can't come to us when we are, or vice versa. So just notice that there might be some errors there. We also have access to some other websites where we can put in, and kind of it comes up with some lists for you where you can kind of compare different
So
plans.
if you take certain medications on a regular basis, you can compare the 2 different plans and see what it will really cost you.
Exactly, or 3 or 5 different plans, whatever you want. So we can have you look at like a no deductible plan versus one that has a deductible, different things like that.
And it sounds like nothing else, double check, because if a website says one thing, it might not actually
Call
be
and check your
true. So
pharmacist.
call your pharmacist and double check on that.
And the other thing we can do is it's a good time to have a medication checkup. So to come in and meet with us and maybe talk to us about what medications you take. And I know we fill them all the time, but when we sit down and look at you and kind of start going through them and talking about them and saying, okay, you take this for high cholesterol. How has your cholesterol been? Or you take this for blood pressure. So sometimes we can kind of look at things and make sure the medications are all still appropriate. Do you still need all of them? Maybe you were taking something for headaches and you no longer have headaches and you maybe don't need that medication anymore. And then also just looking at things to see if prices have changed. Maybe there's new guidelines that you need to be taking maybe a different medication. Maybe there's something that's less expensive that's come on the market that we might be able to switch you to. So it's just a good time to kind of look at everything and have a checkup. So, and this is where we're talking about the convenience of making sure that your provider is covered. And star ratings, that's something kind of new when you're comparing plans. Now on the websites they give a star rating, and that's kind of a quality rating. So if you're looking at a plan that has maybe 1 or 2 stars and it's really cheap, that might be a reason why.
So is this like TripAdvisor but for health plans?
Kind of, a little bit like that.
Okay.
So, and it looks at customer service, their coverage, their track record, those types of things.
Be retroactive
So-
about your health and make sure you ask for some help and get some questions answered.
Exactly.
Okay.
Exactly. Yeah.
All right, so if people want to get a hold of you, what's the easiest way?
They can come to any one of our Medicap locations. We have several of them there. We're on Medicap Central Iowa Facebook and Twitter as well. So shoot us a question or an email, and we'd be happy to help out.
Great
So,
advice.
Yeah, a couple of other quick things I wanted to point out right before we leave.
Sure.
If you have not gotten a flu shot, prime time to come get
Do it.
one. So we have flu vaccine at all of our
Probably
locations.
no lines right now, right?
Actually, we usually get people in and out pretty fast, typically
Yeah.
not a line. So
Good.
walk-in basis anytime that we're open. And then we just had daylight savings time. So we talk about changing batteries and smoke detectors and smoke alarms. Clean out your medicine cabinets at the same time. So remember, get rid of expired, unused medications, but remember, don't flush them or down toilets or drains. So give us a call. We'll help you with disposal.
Okay, so you don't want to throw them in landfills or anything there, do you?
Right, no, we can help. We have some takeaway boxes, and sometimes the city municipalities now have them as well, police stations, libraries, things like that. So you can bring them into us and we'll help you get rid of them.
Wonderful.
Great
Yeah.
advice, as
Thank
always.
you.
Thank
Thank you.